Indiana hospitals have called on the National Guard repeatedly to provide clinical and non-clinical support as COVID-19 continues to overwhelm the health care system. Brock Turner visited one rural Indiana hospital and has this report.
Hospital isolation units across Indiana are full of unvaccinated COVID-19 patients.
The spread of COVID throughout this community is the worst that we have seen so far.
Hospitals usually have more patients during these months, but this surge is different. In addition to high patient counts, Indiana hospitals are struggling to find workers.
As a critical access hospital, we're not used to being at capacity all the time, so we don't staff to be at capacity.
Reitz says the hospital has set records for team members out sick and quarantining, and that's not even the most challenging part.
We have 60 positions posted right now because we have had so much staff resign, and it's not resigning because of the vaccine, they're resigning because they're burnt out.
That's a big reason why her hospital requested National Guard support through Indiana's Department of Health. That help is made possible by the frequent extension of an executive order from Indiana Governor Eric Holcomb. A group of 6 National Guard members arrived in Greene County 2 weeks ago. Sergeant John Nelson leads them.
We've got 2 medics, which I'm one of those. I'm a medic in the National Guard. And then we've got 4 people from other Army MOSs or jobs. So the general support guys do environmental services. We've got one right now that works with the kitchen staff, helping them. We've got one that does some computer work and more clerical. And then myself and the other medic at this particular hospital, I'm doing stuff in the ER and the lab, so doing lab draws. And she's helping in a clinic that they have attached to the hospital as well.
Nelson's team is one of 13 deployed across the state. Each has 2 clinical staff and 4 general support. Initially, teams could support a hospital for only 2 weeks. Last month, that time was doubled as cases surged and the number of new staff quarantined climbed. Nelson, who has served on various coronavirus-related missions during the pandemic, says this one is unlike any he's ever experienced.
It's something that's happening to family and neighbors and here in our state, not something that's happening 10,000 miles away. So it's definitely puts all those statistics into view.
Have you ever had a deployment like this?
No. I've been in 13 years and this is the only time I've done anything like this.
The members of his team echo those sentiments. For Sergeant Carrie Wascom, this deployment is unlike any other. She's from Linton, population 5,400, and is thankful to help her hometown hospital.
It definitely hits home, like seeing that the people that work in my community daily are struggling so much sometimes and overwhelmed.
Everyone reiterated that the situation here in Linton and across Indiana is dire.
It is that bad. Hospitals are running out of vents. I worked in a hospital that we put somebody on the last vent we had. And there's people sick, severely sick with COVID, people severely sick without COVID. But the biggest fact is that we don't have the healthcare workers to provide the care that's needed.
During our interviews, a patient suspected of having COVID-19 was transported to the emergency room here in an ambulance. The hospital has only 1 negative airflow room in the emergency department, and luckily it wasn't in use. Upstairs, the intensive care unit has only a handful of negative airflow rooms to minimize the risk of infection. Each of them is full. That's why an entire hallway is sectioned off.
This isn't about where the virus came from. This isn't about what the virus is. This isn't about how the virus is mutating. It's about you're sick, stay home. If you get really sick and you need help, come to the hospital and we'll take care of you.
Hospital executives across the state admit the level of care is different now. With record numbers of staff sick or quarantined, Reitz says even her role as CEO has changed.
The last few weeks have been very difficult, and if you're calling in the National Guard, I feel like we need to have the message. It is all hands on deck right now. So I walk the hospital in scrubs because if someone tells me they need help, whether it's helping get a patient up from the bedside or take the ambulance that's coming in the door, I'm a nurse and I can do that.
Reitz says the divisiveness that has largely defined the pandemic serves little purpose, certainly not here in the ER.
All of this debate that happens, none of that is really about what happens in this room. At the bedside of the caregivers and the doctors and nurses that are right here caring for you. We are and always will be looking out for that patient's best interest. And we're looking at the facts and data and the numbers that are about you.
For Indiana News Desk, I'm Brock Turner.
At the beginning of this week, the National Guard had sent teams to 30 hospitals around the state. We're joined now by Brian Tabor, president of the Indiana Hospital Association. Brian, welcome to the show.
Thank you for having me.
So we just heard about the stress COVID has put on one small rural hospital. Is it safe to say it's a story that's just being echoed across the state?
Absolutely. We have 170 members, and I think everyone is feeling it. We're seeing the impacts of the pandemic, not just with patients with COVID, but patients whose health has declined because care was put off. We're seeing the effects of COVID, really the pandemic and the length of this pandemic on Hoosiers' mental health as well. So our behavioral hospitals are also very busy.
And we're about to enter a third year of the pandemic. How do you keep that morale up for those that are on the front lines there?
I think it's hard. It's hard to keep morale up. We're doing everything that we can. I think some of the resources that have come from the federal government, there have been some teams that have come to Indiana, the National Guard, the resources that the state has helped deploy. That's a morale booster. I think it says to those men and women that are on the front line in Indiana's hospitals that that the policymakers and leaders do recognize how much they need that help right now. And so I think that's a morale booster to have some of that support and get a little break from those folks. And we're also doing what we can to provide behavioral health services and mindfulness exercises, other things that we can do, anything we can do to help improve resilience right now, we're trying to do.
Do you worry about the long-term effects too? I'm talking, post-COVID, hopefully that happens on hospitals due to the burnout and so many nurses and doctors that we hear that are leaving the industry.
Oh, absolutely. I think the healthcare workforce is going to have to be rebuilt in a significant way. And a nurse leader recently said that there was a projection or a report that came out that speculated we may need 5 years to get back to 75% of the healthcare workforce that we had before the pandemic. And that was a couple of months ago. That was really before this latest surge. So I think that's optimistic. I think it's going to be more difficult than that. So we need help from policymakers, other stakeholders to help us increase the healthcare education pipeline, to help celebrate our caregivers and everything that they've gone through, because we're going to really need to completely rebuild the workforce.
All right, Brian, we're out of time right now. Thank you so much for being on the show. I know you have a lot going on. Appreciate your time.
Thanks again, Joe.